Welcome to DIY Therapy. As always, we'll start with our disclaimer. This podcast is for educational purposes only. It is not designed to diagnose or treat. When beginning any exercise program, it should be reviewed and discussed with your medical professional prior to beginning. Information on this podcast is not designed to replace medical treatment. My name is Will. With me, as always, is Andy.
Hey, what's up, Will?
You staying warm?
Trying to. Record lows for November.
Oh, is it? I didn't hear that.
I don't know. I'm just making that up. So we had a week off last week because of the holiday. How was your Thanksgiving, man?
Good. Ate too much, as per usual. Mm-hmm. How about yourself?
We did the double dipper where we went to my in-laws and then to my side of the family. So we had the exact same meal 2 times in a row. Although I think I'm starting to like Thanksgiving meals a little bit better than what I used to. I used to loathe the whole, the lineup of the food that you constantly had at each one of them. But I think I'm actually starting to dig it a little bit more. So that must be me just getting older.
Yeah, you're getting less of your taste buds are still alive. So that's why.
It must be the pot of coffee I drink every morning.
It's killing you slowly.
Yes, absolutely. So with a week off, we're chatting about a couple different things here today, right?
We're gonna talk. I think we're gonna talk about the estimated time for different tissues to heal.
Yes, which is I think it's important for people to understand this when they're dealing with an injury, whether it's something that they're actually formally being treated for or something that they're trying to work through on their own. There's certain healing times, and I talk a lot to this about patients. Pain doesn't necessarily indicate whether you're having pain or not, that the tissue is necessarily healed or not. So it's always important to understand that, we have really good research out there that indicates how long each tissue takes to heal. And at certain kind of time marks, you're able to load the tissue differently. And so that research is actually very, very good. A lot of the research in our field is questionable, and there's some holes in it. But in terms of specific healing times, it's very, very good. It's been researched for decades, and we've got good content on that.
And when you say load the tissues, you kind of mean like resistance exercises, or if it's like ankle or knee, like starting to walk or doing a little bit more.
Yeah. A perfect example of this is somebody who comes in with like a rotator cuff repair, so they've actually mended the muscle, and or they fixed a tendon. And based upon that, the doctor is going to have a different protocol. Now, after you get done with your rotator cuff repair, you're going to be put in a brace, and you may be not having significant pain after 2 or 3 weeks. So you get this idea that, I'm not having pain, so I can do more. But you got to hit some certain time marks, some benchmarks for time in terms of when the surgery was or when the injury was, to where that tissue can load, tolerate an active motion where you're actually lifting the arm, or whether you can load 2 to 3 pounds, or whether you can do an isometric exercise. So there's certain marks that you've got to hit after the surgery or after an injury of some kind. Does that make sense?
Yes. Yeah, it's just, especially with the rotator cuff, because of the way the shoulder's made up. And if you really want to know how the shoulder's made up, you can listen to our shoulder episodes. Yeah. It just, the muscles and everything, the ligaments really need to be healed. Otherwise, the shoulder will just fall out of its place, essentially.
Well, yeah, it's one of those things, and maybe I didn't clarify this enough. It's one of those things that when you're not having pain, you get this false sense of security that you can do more, and you've just got to recognize that things still need to heal longer, even though pain may not be present. So you can get not having pain is both a blessing and a curse, right? It's a blessing because, hey, you're not suffering, but on the other hand, it's a curse. You may actually initiate more activities or do things outside of the parameters of what you're allowed to do, because you feel like, hey, I'm feeling pretty good. I'm not having any pain. So because of that, you can get yourself in trouble, or even set yourself back a few weeks, or, unfortunately, I've seen people actually, rupture things because they've done too much, because they're feeling so great. So again, it's a blessing and a curse.
Right.
But let's. You want to talk a little bit about some of the specific tissues first, and then talk about the specific healing times for those.
I think we'll talk about tendons, ligaments, muscles, and bones.
Yeah. So for like each one of those, there's going to be a different type of healing time that's needed. So like the most common and probably the quickest healing time is going to be a bone. People have probably heard in the past, like if you roll your ankle, you'd rather fracture the bone versus actually, tearing a tendon or a ligament. And there's a lot of truth to that. And one of the reasons is because, one, the bone takes significantly less time to heal. Typically, in kind of normal people, maybe people 30, 40, 50, you're looking at anywhere to 5 to 6 weeks. And sometimes people can be weight bearing or in a boot even at 4 weeks after a fracture. But when you start talking about like people who are maybe a little bit older or have osteoporosis or osteopenia, which is essentially a thinning or weakening of the bone, sometimes bones can take up to 3 months to actually heal. So always talk, if you have had a fracture, especially in a load bearing joint or bone, specifically your lower limbs, you're going to need to really talk to your doctor about what your weight bearing precautions are. And see when you can start to actually load that tissue.
Yeah, because if you start loading it earlier, you could prolong your recovery or make the injury worse.
Yeah, and it doesn't necessarily mean that it's going to refracture. It may just be something that all of a sudden you're doing real well, but you get walking on it or using the joint or the bone more quickly, too quickly, and maybe a week or two ahead of schedule, and then all of a sudden that makes the pain linger on for another 4 or 5 weeks when it could have been eliminated earlier. So you just need to know that really 5 weeks is probably the earliest, maybe 4 weeks, but it could be all the way up to 3 months depending on how what the shape of your bones actually are.
Yeah, that covers bones.
For the most part. And so then the next one is going to be more along the lines of like a muscle, okay? Muscles are really kind of diagnosed into when you have a tear in a muscle. There can be actual sprains where there isn't really a sprain. There's basically little micro traumas. This is going to be the earliest or the easiest type of recovery where it's really going to be more from like 1 to 2 weeks. So there's not any real structural damage that's occurred. And then you're going to get into more like a grade 1, 2, or 3 tear possibly. And when you're looking at those types of tears, those things can be really more along the lines of anywhere from 2 or 3 weeks all the way up to 3 or 4 months. Muscles will take a lot longer, especially depending on which muscles you're looking at trying to recover from. They're going to take a lot longer if there's actually like a physical tear in the muscle, specifically over 50%. They're going to take a really long time to actually heal, and it could be something that is actually needed to be repaired from a surgical type of operation.
Yeah, don't mess your muscles up.
Yeah.
Professional advice is don't mess your muscles up.
Yeah. So keeping it simple, don't do that. And I think the other thing is, so for any kind of when you do have like an actual tear, partial thickness tear is a lot of times what they're referred to as, or a full thickness tear. When you start to have those types of things, that's when you really need to try to get your physician involved and really have a good idea of what type of protocol you're on, because those types of things a lot of times will have more of a specific protocol. And again, it's not always, just because you're doing an activity that may not cause pain doesn't mean that there isn't risk involved in doing those things to potentially continue to injure the area or prolong the recovery of it. So those are muscles. Muscles are always going to be something that is a challenge because people want to get back to
normalcy.
Their whatever body part was injured as quickly as possible. So tendons kind of go along with that. I mean, tendons are, to define this, tendons are the muscles of the body are going to eventually start to kind of weave themselves into a tendon-type structure, and then that is going to actually attach to a bone. So if you've got some type of rupture or laceration of a tendon, then things can be significantly longer. If it's just a simple laceration, like a small laceration, it could be anywhere as quickly as 5 weeks that you have some type of recovery. But if it's a significant laceration, like 50% or more, it could be up to 6 months. So like a lot of times people will have lacerations in their tendons. They get cuts like in their hands or their wrists. And so they may actually be splinted for a significant amount of time to make sure that the tendon isn't loaded and so that the tendon has enough time to heal in the hand. So that splint would actually put that tendon, in a position where it's in a shortened position, so there isn't a lot of strain or stress being placed on that so that it can heal properly. But then if you actually have like a actual tendon rupture, now you're talking big time, like 3 to 6 months in terms of healing. So let's avoid those as much as possible.
Just explain what a rupture is.
So a rupture, like a laceration, would be.
It's kind of what it sounds like.
Yeah, and it's more along the lines of like an injury with like a lot of handyman, carpenters, maybe construction workers, blue collar workers are going to have more of these types of injuries because it's like a physical cut that's going to occur. Certainly, it could happen, like in a car accident or something like that. But a lot of times people are having lacerations where it's like literally like a knife that's like coming through and cutting or an injury with like a saw. That would be considered like a laceration. A rupture is when you're having more of a break in the tendon due to overloading the tissue, and it's usually done through like a physical activity. So like a real common tendon rupture would be like an Achilles tendon rupture. So maybe you're a weekend warrior and you like to go and you run and you play softball, you play basketball on the weekends. What might happen is you come down real quick rebounding a ball or something, and that tendon will actually just rupture and pull off. It's not due to like an outside like saw or some type of knife or some type of physical trauma like in an accident of some kind. It could be that you're mowing the lawn and you stepped wrong in a hole that you didn't see that was there, and that heel drops down too quickly and you get a rupture of that tendon also. So a rupture is usually more from like a very quick load of the joint, and the structure wasn't ready for it, and or it was too much strain that occurred through it, and then you have that rupture. We'll see a lot of times people have like a quadricep tendon rupture. And this is because a lot of times they'll get their foot stuck and fall backwards, and their knee will bend backwards way too quickly, and they'll kind of fall back on top of their knee, and it'll actually rupture that quadricep. And so typically with a rupture, there is some type of surgical intervention that occurs, and then you're going to be placed on a very specific protocol again. Those types of injuries are at minimum of 3 months to heal. Many times they're mobilized early on, meaning that they're not allowed to move at all, and then you're slowly allowed to kind of introduce some different activities, different strains and stresses on the low-grade strains and stresses on the tissue, and then slowly build that back up.
Yeah.
How to explain the difference of those?
Yeah, that was good.
Yeah.
Because I always feel like if you don't understand the rupture, it just sounds. I mean, it's bad in and of itself, obviously, but just the word rupture just sounds almost explosive. Yeah, it just sounds explosive. Like what my ankle or my Achilles tendon just blew up. I mean.
And that's not the case. It's simply the tendon couldn't accept the load that was being put through it at that specific time.
Yeah.
Could have been worn out, could have been, something that was framed for a long period of time, could be due to the repetitive stress, or it could be just due to one load that it just wasn't used to.
Yeah.
So, and they stink, I mean, there's no kind of, there's no sugarcoating that. They're not fun types of injuries because you're down and out for quite a bit of time, but usually people ruptures and things like that come back just fine. Especially if you're a non-athlete and you're looking to just do normal everyday activities. People really recover fine from them.
Yeah, it just takes a long time.
Yeah, and kind of the whole point of this is this podcast is just knowing and listening to and giving you the advice to listen to your medical professional in terms of following those protocols, because again, you can feel much better than what the tissue can still actually load, so you get kind of ahead of yourself, and then you can put yourself in kind of a potential risk for re-damaging it or prolonging that injury.
Right.
Yeah. So then the last one's ligaments, which I don't know, probably people are more familiar with it nowadays with the whole, the most common injured ligament is, the ACL injury, which we've all heard of from an athletic standpoint. Ligaments tend to take the longest to heal.
And why is that?
Because it typically has the lowest amount of blood supply.
Yeah.
So
the more blood supply a thing has, the quicker it is to get the nutrients it needs to heal, and speeds up the healing process.
Yep, absolutely. Yeah, and so, and it's also a non-contractile tissue, so usually it's something that it's usually when the body or the structure is moving in a way that it shouldn't move, like rupturing the deltoid ligament on your ankle is when you roll your ankle real bad, or if you twist and kind of the knee goes inward real bad, you can rupture the MCL ligament. So usually it's more of stepping wrong, twisting wrong. It's not usually like like an explosive activity, like how a muscle rupture could occur. So you do want to be cautious then, when you're recovering from, say, like an ACL injury or an MCL injury, which are injuries of the knee. You want to be careful about, how much force you're putting through that knee at given times during the healing process. But again, those are, an MCL doesn't have to be a surgery. A lot of times it is if there's other structures that are involved. The ACL is almost always a surgery. But usually when you're doing some type of ligament injury, you're going to also be following up with some type of rehabilitation and some type of protocol, again, from the doctor.
Right.
Yeah, so just be cautious of that, and again, follow their instructions. Usually there's if a surgeon is not giving you a protocol in regards to an injury like this, then should have picked a different surgeon. So, yeah. I don't know, any more to add there?
No, it's just the big takeaway from all of this is you're going to be wanting to move before you're actually ready. You're going to be feeling fine, and you just need to not rush it. Because that's going to be the big thing, is just, taking your time and understanding that despite the fact that you're not in pain or you have less pain, that, that's not a go sign. That's a go slow sign at the very least. You just don't want to rush into anything, because it could make things prolong, or, so if you want to heal as fast as possible, just be aware of these guidelines.
Yeah. I think the other thing, there are a lot of variables that make people want to push further and quicker. There's a lot of economical, financial reasons. Maybe you can't go back to work. Maybe you're on light duty. Maybe you're on FMLA, where you're actually off work altogether. So there's a lot of reasons why people want to get back quicker than what maybe they're capable of. But the big thing, this is something that I tell a lot of people when circumstances are like that, is you want to look at this and put this behind you. We need to be thinking. We can't be thinking short-sighted. Okay, what am I going to be doing in 6 weeks? We need to really be thinking. Okay, am I healed in 6 months?
Yeah.
Or a year from now, is this completely behind me, or did I push back too quickly and now I've got chronic knee pain after an ACL injury because I went back to work too quickly, and I was climbing ladders and just kind of kept tweaking it over and over again. So you want to think big picture here and not be real short-sighted in this, because the overall goal is to get you back to normal functionality without chronic pain. And a lot of times what we see with people is they get back to things too quickly or push too quickly, and then they end up having these small little injuries and small little pains that just kind of continue to linger.
Yep.
Yeah.
I don't have anything to add to that. It's pretty. That's pretty good.
All right. So, anything else?
Tendons,
ligaments, bones, muscles.
Those are all the major things that we deal with. Mm-hmm. There's other structures inside you that we don't mess with, but.
Yeah, well, I think the other thing that we could just touch briefly on is like nerve injuries. And one of the reasons why we weren't going to talk about this earlier, but I'm bringing it up now, is nerve injuries are just, but we don't have good data on that. Everybody, it's just a crapshoot. Some people do really well with them. Some people, nerve injuries, can take up to 18 months to heal, and sometimes they never heal. So, that's just another thing to be.
It's a flip of the coin. It seems like to me. Depending on depending on how it's injured, and it just doesn't. I just don't know enough about. It just seems like a literal flip of the coin, and if they're going to get better or not with that some of that stuff.
Mm-hmm. Yeah, and obviously there's things for that we can talk about on another podcast that can kind of set yourself up for better success. But and then clearly there are things that can prolong that a bit. But nerve injuries can take anywhere from 2 to 18 months. So it's a long haul with those. Yeah. All right. Let's wrap this up. What do you say?
That sounds good. This podcast is for educational purposes only. It is not designed to diagnose or treat. When beginning any exercise program, it should be reviewed and discussed with your medical professional prior to beginning. Information on this podcast is not designed to replace medical treatment. Remember, treat yourself.